This presentation will be given by Karen Torrejon. The community analysis will be of the city of Kissimmee, and it will be compared to the city of Orlando. In the 1700s, the city of Kissimmee was home to Native Americans, such as the Seminole tribe. A leader called Chief Osceola, pictured on the right, emerged to fight the way the Seminoles were being treated at that time. To honor this chief, the county was renamed after him, now called Osceola County. During the 1800s, there was a well-known trading post called Allendale that would later be renamed Kissimmee City in 1883. In the 1920s, there were 2,700 people in the population. In the 30s, the cattle industry began to increase, and by the 1940s, the population grew to 3,700 people. The population growth was also due at that time due to construction of the Kissimmee Airport in preparation for World War II. By the 1970s, the population surged with the development of Walt Disney World, and the population increased to 30,000 people. Today, the city of Kissimmee's area measures 21 square miles, not including the non-incorporated areas of Kissimmee, and the population has grew in 2015 to over 65,000 residents. Currently, the concerns for the city is the ongoing construction projects, causing a lot of congestion in the roadways, causing a lot of noise annoyance, causing air pollution, and it's a real concern at this time. When comparing the age population with both communities, there is a 4% higher youth population in Kissimmee, under the ages of 20, compared to Orlando. This statistic correlates to the increased child homelessness in the area and family homelessness. This is a real concern. Most live in local motels on the 192 corridor, a main roadway that runs through the city. When analyzing the population between these two cities, there is a vast difference in the total population and the density. Kissimmee's total population is almost half of Orlando's population, but the amount of people per square mile is higher in Kissimmee, which can lead to overcrowding issues and housing deficiencies in the area. Also, another area of concern is a sharp increase in the Hispanic population in Kissimmee, at 61% compared to Orlando's 28%. A higher Hispanic immigrant is seen at our clinics, at the health department where I work. Many of my pregnant patients are illegal aliens, have no health insurance, and are living in poverty. This vulnerable population is at risk for health disparities such as lack of access to care, increased incidence of disease, and poor health outcomes. When analyzing income levels between these two communities, Kissimmee pictured in blue and Orlando in green, there is a 10% higher rate of people living in poverty in Kissimmee compared to Orlando. But there is also 5% less middle class and 6% less upper class levels also. Another area of concern is that almost half the entire population of Kissimmee, which is 45%, is living in poverty. This leads to chronic stress and multiple healthcare issues with this community. When analyzing housing structures between both communities, Kissimmee represented in dark blue on the left and Orlando in light blue on the right. Orlando has a higher renters rate, while Kissimmee has a higher owner rate. However, the amount of the total housing units is 4 times less in Kissimmee compared to Orlando. With a higher housing density and average family size in Kissimmee, there is again an issue of overcrowding. Since Kissimmee's population is half of Orlando's population, there should be at least 60,000 units in Kissimmee to be equal to Orlando's. The school structure comparison between both of these communities reveals an imbalance of the ratio of schools to the population. In red, Orlando has 3, 4, almost 5 times more schools in the preschool, elementary, middle, and college level compared to Kissimmee. The high school graduation rate for Kissimmee was 82%, while Orlando was at 90%. And the bachelor level and higher education obtained by Kissimmee was only at 15%, while Orlando had double that at 34%. The concerns that falls in Kissimmee is that there's less higher education facilities, whereas Orlando has the second largest university in the whole U.S., the University of Central Florida. Other structures in Kissimmee that are lacking is libraries. There's only 2 libraries available. One is the Hart Memorial Central Public Library, available to everyone, and the Valencia College Library, but that's only to students. The other places of concern is food banks. There is a Second Harvest Food Bank of Central Florida, but they're based actually in Orlando. Their main hub is there. There are limited and only affiliates working with Second Harvest and Kissimmee, so we have less availability of food to our residents. The transportation issues are not lacking. Only thing lacking at this time is a sunrail, but it is coming. While doing the community analysis project, I've noticed that there are only 2 acute care hospitals available for our residents, but there are more urgent care, and then there are many walk-in clinics, not considered free, but more of a sliding fee scale to offset the costs for the supplies. Also, the Orlando VA Medical Center has an outpatient clinic available to our veterans here. If they're homeless or not homeless, they're able to help all veterans. When completing the windshield survey, I noticed that there were lack of housing available for the homeless. There is a community hope center available for teaching life skills, assisting them getting insurance, assisting giving services for free for being able to find employment, but their housing issues are not available. The closest shelter is in St. Cloud. Now, there is another resource that's great for seniors called the Osceola Council on Aging. There are apartments that are managed by this company, and they're non-for-profit, and they help the sister facility, help them with companionship, help them go shopping, providing transportation, helping them with their personal care, and this is definitely a great resource for them. Also, mental health. There is a free mental health available to many, depending on their sliding fee scale. They can get the services free, and since there are many living under the poverty level, there are available resources for substance abuse, alcohol abuse, and also domestic violence. Also, with the HIV outreach, there is one center called Hope and Help Center of Central Florida, which is strictly only for HIV/AIDS new patients who are needing help to try to get care, to try to get medication, and to try to help them live with the disease. When doing the comparison of communicable diseases between Kissimmee and Orlando, I have found that hepatitis B, chronic hepatitis B in Orlando, is 10 times higher than the one in Kissimmee. That's a vast difference. The chlamydia is higher, but not by much. Gonorrhea also is high by at least 3 times. That is a definite significant difference. So the city of Kissimmee is doing a lot better when it comes to the rate of communicable diseases. The top 2 leading causes of death for both Kissimmee and Orlando is heart disease and cancer. However, if you notice on the green chart, which is on the right, they're both exactly the same, 22.8%. However, in Kissimmee, heart disease is almost 6% higher. That would be an issue of concern, especially with the Hispanic population and the dietary habits, and also higher heart disease in that population. So the nurse would definitely focus on the dietary DASH diet, controlling their medication and their lifestyle, physical activity to help this population with this issue. The areas of concern regarding healthcare is barriers to care with the Hispanic immigrant population for fear of deportation, issues with transportation to and from healthcare facilities such as the homeless population, rural residents, and also the ability to afford healthcare. When developing Healthy People 2020, there are 3 objectives applicable to the city of Kissimmee. The top priority would be the proportion of persons living in poverty because of the low income level and the ones living in motels. The second one, reduce the proportion of persons who are unable to get care or delayed in getting any medical, dental, or prescription medication. The third is reduction of coronary artery disease deaths because it's a leading cause of death in Kissimmee at a rate of 144 per 100 people. During the windshield survey, I found no environmental health, safety, or hazards. The Lakefront Park, for example, has lighted trails. They have their own bike lanes away from the street. They have lighted pathways, so there's no danger at night. And the lakes, it's cleaned up because they have a renovation project that just cleaned them all up. So that's great. Community facilities also, they're safe. They have lifeguards for the aquatic center. They have safety issues, regulations in place, and the recreations available for the public. No issues were found with the water quality, especially with the lakes in Kissimmee. An example would be the main lake, Lake Toho, which receives more than 82 visitors a year. They've gone under nutrient reduction plans to get rid of the invasive plants. The chlorophyll level was decreased by 68%, and the project that in 2014 has decreased the pollutant load into the water, so making the lake unimpaired. And it's been that way for the past 6 years. The community analysis and air quality between both communities shows the favorable projects for Kissimmee at this time. However, the city of Orlando has future endeavors that it might actually be better than the Kissimmee. For example, on the right side, on the bottom, it says there are going to be future 200 electric charging stations for cars for electric vehicles. They're going to be selling more cars. To drive electric Orlando means they're actually going to be selling more to the public. And they're going to have city fleets, meaning government trucks, the garbage trucks, and they're going to have buses that are going to be either flex fuel, hybrid, electric in nature. So they might actually be better in the ozone in the future compared to Kissimmee. So in that aspect, Kissimmee is lagging. Other environmental issues that of concern for the city of Kissimmee is public safety, meaning that the response time is longer, especially for the rural areas. The solid waste, no issues there, but the trucks that are being used right now in Orlando have actually hybrid models. They use less gas, less flex fuel, so they're actually better than Kissimmee at this time. And the fire and rescue are a lot better in Kissimmee. The response time is less than 4 minutes, and they're considered the top 5 in Orlando as a Class 1 rating as a fire department. The government and public policy of the city of Kissimmee is made up of a city commission, under that a city manager and a city attorney. The mayor currently is Jose Alvarez. All the commissioners are voted by electoral process and can hold 2 4-year terms, 8 years consecutively. A current example of public policy is disaster planning. The city of Kissimmee has an updated plan called the Comprehensive Emergency Management Plan. They have escape routes ready to go, and they have also special needs shelters for any high-risk individuals that may need medication or oxygen. General populations of various schools always have that as a resource. A major global concern in this population is family and child poverty. The role of the nurse as a public health nurse is to monitor with gathering data, assessing the impact of poverty, also alleviating, helping find resources, help them claim benefits, and also bring about change using empowering strategies with clients, initiating community discussions.